Hi, everyone. This is Patti Napolitano with Wellness Cleveland. And my husband will not let me tell party stories anymore. Since I was doing work uh, in the jail with some pretty high acuity and disturbing, like criminal minds kind of people, my funny party stories aren't funny anymore. But I have been in private practice for about 5 years exclusively now. I was dissuaded from private practice for many of the 25 years of social work because I'm so social. I'm such a team person. I'm such a planner. And people said, you're not going to get paid for the things that you're best at. Never did anyway. You're not going to have income security. Never did anyway. You're not going to have health insurance. Very true. And we do pay a pretty penny for our sometimes horrible insurance. And once we've met our $7,000 a year family deductible, we have wonderful insurance. So it goes in America. So in private practice, also, people have a tendency not to take higher acuity referrals. Now, because of my specializations and my comfort and my competencies, I do receive referrals other clinicians don't. But it's been like that my whole career. I kind of have, like a vibe. If you have already served time for stabbing someone back, you're probably going to really get along well with me. I'm going to give you some of the quips. In private practice, so I have worked, sidebar, let me continue on to my point before I tell you the hilarious things I've learned or heard in the last 48 hours. You should not dissuade yourself from working with suicidal children, suicidal adults, people who might need to be hospitalized against their will, people who are looking for assessments to return to work, functional assessments, all of these things. I mean, this is like the pocket DSM-5. You can look it up on Wikipedia. I do not support the American Psychiatric Association for patriarchal and oppressive reasons. However, I can assess neurocognitive conditions with my knowledge of human development across the age span, as could any social worker who's taken human behavior in the social environment, because we certainly go over several different kinds of developmental theories. And if you pick one and apply it, you've met the standard. And many of these things in the descriptions in the DSM will talk about the functional impairments, what we used to call the GAF, Global Assessment of Functioning. How is this person doing in their life? So we're not treating a disorder, we're treating a person, right? But we're not treating the label, we're treating the intensity of how much it's interfering with people's lives. So to assess that risk, you would not really want to make that decision on your own anyway. So there is a national suicide hotline, and there's a national a lot of things hotline. I use YouTube. I use Google. I turn to my computer. My patients sit right over here. This is a new monitor. Let's not break it. So my patients sit over here. I'm often in a chair over there with my laptop or my notepad. Or I come over here and we Google. Today we're looking up divorce options in Ohio. I look up all kinds of medications, interactions, how much ibuprofen does it take to kill a dog. You should see the hotlines that come up, and you can just call them as a clinician. And anytime I'm making a children's services referral, adult protective services referral, or a hotline call, I do it on speaker on my phone. I just put it on in between the patient and I, which is exactly what I've done every time I've helped someone apply for Social Security or a disability bus pass or request an income verification, is we do it together and we practice the emotion regulation while we're doing it together. And we think about how to explain it to those people, including people on the domestic violence hotline, sexual assault hotlines, and those people, even when it was illegal, it was legal in the United States when I had my second child in 2004, to be fired from your job, evicted from your home, refused a business loan because you were a suspected homosexual. And I know people in my working age who have been let go from a position. And the reason was, you spend so much time around women. We didn't want your association that you could be a lesbian to affect us. This was someone who was straight. So that kind of oppression has been a topic in therapy rooms for a really long time. And that kind of topic has been around on suicide hotlines for a very long time. So although there are things that are being cut, I would always encourage you to take on an assessment, right? Because there are patients who come in who have so many red flags, and I meet them and that's all they are. Those flags like don't hit dirt. They're 2 inches down, and they're not actual indications of underlying harm. Other people, I have been talking with them about their suicidal thoughts for 5 years, every session, but they've been living with them for 50. So the risk is lower. So there are risk assessment tools that we can use to cover our licensure and to help guide our decision making. And that's really any kind of tool that I use. I like to use it as a structured conversation piece to the patient to say, like, oh, on a scale of 1 to 5, what do you think? It feels like a 5. It sounds like a 4 because I've seen you more elevated than this. Do you remember this one time? So again, building the relationship is the key, and you can do that regardless of someone's diagnosis or risk factors. And some of the most hilarious things that I have heard that you just never know. I'm going to try to actually deliver these lines as if I'm reading them. I have had multiple conversations today with people with multiple diagnoses about biblically accurate angels and what they look like and what would they feel like if they touch you. Today I had a conversation about mushrooms, how we medicate with mushrooms, how we medicate with ashwagandha, lion's mane. And I said, is this the thing that's causing you to make deals with the demon? And he said, no, those were the other kinds of mushrooms we're self-medicating with. Me walking to the bathroom in between sessions, one of my adult male clients coming down the hall. I'm like walking with a patient talking, and this other guy comes down the hall. Let's go. You want to see me? Not how I thought my patients would talk to me in the hall. It's all love. It's a very friendly relationship. Me to him, you're on warning with the receptionist. Please just sit down this week, please. Another patient. Can you help me understand, is Diddy Rapstein or Hip Hopstein? No wonder he kept changing his name. I don't know what to put that in a progress note. There's no list. You can't blackmail anyone if you expose everybody. That's a real documentation quote this week. Captain's log, Stargate, July 18th, 2025. Referencing my little Norwegian pop star. This is where I was asking, what is this? Is this mushroom related? No, Aurora. Top 3 songs for this patient. There is no cure for me. We point out in Ethiopia, it's 2018. I don't really know what that means. Then he says, I turn on this song by Aurora, my little Norwegian pop star. And I said, I have to see if this is real. We pull it up, we put it on, totally relaxes, and we start talking about a dissolution. And then says, I also like to listen to The Seed and Conqueror. So the only thing I'm doing in this interaction is listening to ridiculousness, which if you're going to treat firemen, or if you're going to treat police, I should say firefighters, police officers, iron workers, people who have like walkie-talkies for their job and they're not really talking on the job, they're more bullshitting when they get the chance. You have to be willing to tolerate that kind of like joking and rapport and not be so serious, because it's really not that serious. And people in my life say, hop two, I'm here to say you. And like, if I'm going to get totally butthurt about that, that is not a great indication of emotional regulation or that I have any awareness of countertransference. If I feel like emotionally threatened, because I have to be willing to have people push the envelope with me and take it in good humor and be like, yeah, that's not like damaging to me. That's not threatening to me. It's not threatening to my credibility for you to see me as a human, and like do what you need to do to be comfortable. Certainly always having been a gender, like a co-educational athlete. I was in track, I was in cross country, I was in marching band, and you're just always around people of multiple genders. And so you learn to kind of relate. And males just kind of have a sense of humor that you have to laugh or not laugh at them to give them the appropriate reinforcement, because sometimes it's funny. We talked about a lot about Jim Henson today. I talk a lot about Jim Henson most days. Why does everyone want me to be a cult leader? Great question. Great question. In the Ottoman Empire, you could divorce your husband for not giving you enough coffee. Did not know that. Learned it. I'm going to learn more about it. This one was from yesterday, and it was really out of nowhere. We usually talk a lot about cadavers with this other patient. And said, they interrupt and say real quick, wait, I've been sleeping on this talent my whole life looking like a fuck ass who. What the fuck are you talking about? The things that children will say to you, it's not all about just like skibbity and slay. I hope I have expressed to you that there is fun to be had, and there is documentation and support to guide you through whatever your intrepid soul might want to do. Maybe you don't like the mystery and curiosity of talking to people about what they've got going on spiritually to determine, is this a psychosis or not? And that's okay. I've had a lot of years of weird with support to get used to that kind of vibe. But what is the vibe you're looking for? And when you're designing your independent licensure, your clinical career, don't wait until someone offers you a job and say, I guess this is my population. Really think about the kinds of patients you enjoy spending time with. I was raised by top-notch dad who was like everyone's favorite godfather, golf coach, and person to cook and wash dishes with. So I have a very unique relationship with adult men that a lot of women don't have my age in my region. So maybe you don't want to work with adult men, but I will tell you that I shied away from them for the first 20 years of my career because I thought, I'm a women's therapist. I'm a family therapist. And guess what? Families have dads and uncles and cousins and brothers and sons. And the more kinds of relationships we have in our lives, the better we're able to determine boundaries within a clinical relationship, because you have to build and feed that clinical engagement. And you have to do it in a way that's non-possessive, which is hard for me because I just love all my people and I claim them as my own, but I try to gather them in a non-possessive way and say how fortunate I am to get to witness for these people, and not be like, oh, my nephew or oh, my baby. You'll hear people in particularly in residential programs will have like an aunt or an uncle, and that's like some countertransference things. We don't want to have a possessive warmth for our patients. And I do use that relationship and that sense of humor to say, I have to back up, because as your treating therapist, I know that I cannot make you ask someone to go on a date. I want to, right? I cannot make you call an attorney. I cannot make you be ready to leave a situation or address a situation, right? But I can give you dignity and honor, respect, and non-possessive warmth, which is what is missing from the relationships in our lives. Because my husband has a vested interest in what I choose, and my mom has a vested interest in how I behave. So those people are going to give you, naturally, as a result of your relationship, some possessive advice and advice that will impact them. In therapy, in social services, when we're brokering services, when we're advocating, we don't want to force people into one choice, take it or leave it. So those are my tips and welcomes, and I hope that you like and subscribe everywhere you can. And you can always book a time to talk with me on my website. I have a book now button for 15 or 30-minute consultation calls for free. wellnesscleveland.vip. Thanks.